Right, 20 minutes before 7 here on this Thursday morning, the World Health Organization has warned COVID-19 could overwhelm strained public health systems in sub-Saharan Africa. Countries across the globe are taking measures to try and limit the spread. With more cases than any other country in sub-Saharan Africa, South Africa is implementing plans to step up on precautionary measures. This includes strict entry rules barring travellers from high-risk countries. In studio with us, we've got the Home Affairs Minister, Dr. Motsoaledi. He's going to discuss this further. Minister, good to see you. Thanks very much for coming in to talk to us.
Morning, Leanne, and morning to the viewers.
So obviously we're still sitting at a number. I know you're not in the Department of Health, but we're still sitting with that number. Nothing else has been declared at 116 cases in South Africa. Have you heard anything else since yesterday's update?
No, not yet. I think you're aware, Leanne, that the Minister of Health updates us every day. And you might remember that the President said he's establishing a national command center, which he chairs personally. And it meets 3 times a week, and it's meeting today, this afternoon. And I'm sure we'll be told there, because I'm a member of that structure, as are other ministers in other departments. We're going to be meeting today. I'm sure we'll get the current figure.
Okay, so this is something a lot of people are asking, and I ask you because I have you sitting in front of me with being on that council. Some say that the numbers coming out are a little bit slow, and could it not be a little bit faster, that maybe government is trying to keep things calm without being alarmist, but we need these faster? Can you address that concern from South Africans?
Well, look, you are aware that we don't just issue numbers. We issue numbers as the National Institute of Communicable Diseases provide results. Yes, they are testing people and providing results. And it takes time to provide results, especially accurate results. You might be aware that there's been some problems about false negatives, which have to be corrected by the NICD. So the Minister of Health, Dr. Zweli Mkhize, depends on the results from the NIC to announce to the public the accurate results of how many people are positive. And he can't do it any faster than the laboratory can produce results. It's not possible.
And these, of course, I mean, these results are, this is global. I mean, this is a global pandemic and everybody looking to the numbers. So there has to be responsible reporting from every single country. And that's my understanding of all of this. So I hope that puts a lot of concerns at bay for some South Africans.
Definitely there has to be responsible reporting. I had 100%. People trying to believe a minister can lie and give low figures. This is not in anybody's interest, and that's never done, because it will soon be discovered anyway if you try to lie. So nobody's lying.
Good. Fake news, also something we need to watch out for.
Well, I'm sure you read from the regulations that now is illegal. Anybody who tries to spread fake news will be arrested and is liable to a sentence of up to 6 months in prison. So it's no longer something that we're just frowning upon, because misleading people can be as dangerous as the virus itself.
So let's give out some facts here. Again, some concerns were raised about South Africa perhaps acting a little bit slow when we saw cases already coming in from other countries, that we should have acted faster to close the borders, what we have done now. What do you say to that? I mean, could we have acted faster in hindsight?
I think we acted appropriately, Leanne. For instance, people always like to criticize because they always look around the world. If they see somebody doing something, they believe my country should have done that. Let me give you an example, and it's a painful one. When the disease struck in China, many countries which are well-to-do, especially developed countries, rushed into China to fetch their citizens and bring them back, especially in Europe, without checking anything, without taking any measures. Do you see what's happening now? We delayed a bit, and we criticized why we are not rushing to China to take our citizens. They were quarantined. There was a lockdown. There was a lockdown in Wuhan. We brought them in the manner in which we did, and I'm sure you'll agree with me that that was a clean job. We didn't just close our eyes and rush in. So I think the time at which the government started ratcheting its response was the appropriate time.
We look at the different borders that have been closed. So the department announced, we heard from the president also saying 35 out of 53 land borders with 5 of the 6 neighboring countries have been closed. What determined the closure of these specific borders? Why?
Yes, there are 53 ports of entry into South Africa. Now, the criteria we used of which one must be closed and which one must be left open. Remember, the bottom line here, we trying to reduce human contact. We are trying to do social distancing. That's the underlying philosophy behind the closures of borders. So what we did, we checked the borders where there's no economic activity at all. In other words, there's no commercial activity. It's just people going through and cars going through this thing. We looked at those. But secondly, at our borders, we have got 17 entities of government. Home Affairs is always there at the borders, of course. Health is there, but not in all of them.
Yeah.
Port health authorities, right? So we looked at the borders where there's never been any presence of port health authorities, because we don't want to overstretch the healthcare system. Port health has hired 90 extra workers, but we don't want to distribute them thin around the ports of entry. We want to concentrate them on the busiest ports of entry. So it will be wiser to close all the others where they've never been. And when we calculate with these 2 criteria, that means the issue of commercial activity, the absence of port health, we found that 35 ports of entry qualify in that regard, and they are the ones we closed. In fact, in most of them, you'll find only the presence of 2 entities, a Home Affairs official who stamps passport and police, South African Police Services. In most of those borders we close, you find only those 2 present. And so we thought there's no need, there's no gain in them remaining open if we have to reduce movement. And remember, Leanne, many people believe we are doing so to protect South Africa. We are actually also protecting our neighboring countries against ourselves.
Yeah.
Remember, we are the one country around SADC with the highest number of people who are infected. So we would like to spread the disease also to our neighboring countries. So it's a two-way thing. We protecting ourselves, but we are also protecting them.
It certainly is, but some people still desperately coming into South Africa through unmanned borders, through fences that have collapsed. We know this. We know it's a big issue in South Africa. I mean, we've got a lot of people writing to us on Twitter here. There's one saying, Mahlandu Masango saying, there are more unofficial entry points than official entry points. They go on to say, for every 10 black foreigners in South Africa, 9 enter through unofficial means. And that in itself, I mean, obviously that's a statistic that a viewer has come up with, but it is not true to a certain extent, because a lot of our borders are unmanned and people just walk through. What do we do in those cases?
Well, Leanne, yes, we have acceded to that.
Yeah.
About our porous borders. We never try to run away from that or denying it. It is there. Now, at the moment, I was discussing with you about our ports of entry, where people enter officially. Because the borders consist of ports of entry, the gates where people enter, but also a borderline. Now, a borderline is a function of the South African National Defence Force. Well, many people believe everything about the border is Home Affairs.
Yeah.
But that border line, the perimeter, that means the perimeter fencing, which you call a borderline, is the function of South African National Defence Force. And that worry about people just coming through has also been expressed by the ministers in the neighboring countries. When I phoned them to tell them about the decision to close the borders, they got worried about illegal crossings and discussed that our armies in the respective countries perhaps should meet and up their games. We have also raised this issue at the National Command Council meeting chaired by the President about the fact that the defense forces must perhaps up their game to make sure that there are no illegal entries. But having said so, you are aware that Parliament has now passed the Border Management Authority Bill, the BMA Bill, where we are going to establish a special Border Management Authority to try and make sure that they decrease the porousness of our borders. That bill has just been passed 2 weeks ago. We're just waiting for the President to sign it into law so that we can start implementing. But in the meantime, we're asking the armies of our respective countries to up their games at the borders.
Yeah, one would expect that the SANDF acts on this immediately and stands there and protects those borders, because this, as you say, is not only protecting neighboring countries, it's protecting South Africans as well. And maybe these changes will be changes that will be in there for good, because it's a major concern of South Africans. It really is. Our porous borders need to be sorted out. They really
Absolutely,
do.
Absolutely. That's why this issue of Border Management Authority, when we looked, we found the best way to manage our borders and stop them from being porous is to have a special authority there whose job is to implement this work of making sure that people can only come to our country legally. I'm not sure about the statistics that has been mentioned there, because that's not necessarily the figures that we are having in terms of the number of people who are documented and undocumented. Only that, yes, of course, nobody can know undocumented number of people in the country.
Indeed.
Because most of them don't want to be known anyway.
Yeah, indeed. I want to put up a graphic. We had a graphic a bit earlier about some of the border closures. If I can ask the team just to put that back on screen, because there is a concern from some people. Here's one being raised, saying people from Stakspruit to Lesotho are locked either in Lesotho or Basotho, are locked in EC. Telebridge is the busiest border gate between EC and Lesotho. It's been closed. The question is, does the minister expect people to go all the way to the Free State now to get assistance? This is just one border we're talking to.
Well, Leanne, we have got 14 border posts with Lesotho. And we're addressing 9 of them. We're still remaining with 5. These are tough times. These are not times for relaxation of luxury all over the world. It's tough. We've never said we're going to close borders and nothing will change. Something will change and there will be some form of inconveniences, and people ought to know that. Otherwise, why should we be taking action? These are stringent measures that have been taken all over the world, and we know that they are uncomfortable, and we are calling people to cooperate. That's why the president even called political parties that we must, even drop our differences. When political parties are there in parliament, their job is to oppose sometimes everything you're doing and say this is not the time to oppose just for opposition. These are tough times. And there are not tough times in South Africa only, around the whole world in fighting this coronavirus. So when people talk about inconveniences, yes, we have got to live with some of them for the greater goal of making sure that we flatten the curve of the advance of this disease.
And rightly so. But one of the problems that we're also faced with at a lot of our border points of entry, and those that are operational, is the issue of bribery, of monetary gains from Home Affairs officials that are working there. They're going to be long queues. They're going to let people in. These are things I imagine. I'm not telling you things you don't know. These are real issues that are going to happen now. We're not only talking about formal borders, but citizens bordering countries like Botswana and Mozambique. They're all raising these concerns as well. What is the government doing about the reality of this in this critical time?
Well, Leanne, when you mention a board of entry, you don't mention Home Affairs only. There are 7 entities there. That means 7 different government entities that are at our borders. Well, the main one, of course, is Home Affairs, because we have got to check licenses and permits to come in. But we also have customs. They are dealing with lots and lots of monies. You also have health, Port Health, as I've said. You also have agriculture. You also have environment. You also have South African police services. All of them, in one or the other, can be corrupted, and we are aware of that. That's why the Department of Home Affairs is one of the few departments in government that has got a special branch which deals specifically with the issues of corruption. This is a battle we fight every day, and we do dismiss people time and again when we catch them, but it's an ongoing battle because there's a lot at stake. If one person wants to come here illegally, there are quite a lot of people with money. For instance, we have just finalized a case now, which we are going to announce publicly because it's a big one, of one of the officials of Home Affairs in our mission in Namibia, who has been selling visas to Pakistani and Bangladeshi nationals to come into South Africa. We've been investigating that for 3 months. We've got the facts. We've gone through disciplinary hearing. We've given it to the Hawks. And we have been able to establish who are the people who got those visas. We're going to search for them, but they were sold. Yeah. So it's something that we deal with almost every day.
Indeed. Minister, in terms of traveling, we know that some... basically, you've introduced visas now to high-risk countries which normally enjoy a visa-free status into South Africa. Which are those? How is this going to be managed now?
Well, we take our hit from the World Health Organization. They've classified certain countries as very high-risk countries, and most of them are in Europe. And as you know, they mentioned Italy, they mentioned Spain, France, Germany, UK, USA, South Korea, Iran, and China. Yeah. And so we had to deal with them. And in all those countries that have been mentioned, only China and Iran were entering South Africa with passports. The rest were passport free. I mean, not passport exist.
Visa
Let
free.
me correct myself. Visa free. Yes. Yeah. The rest were visa free. Only Iran and China used to apply for visas. Now, we have already issued them visas in January and February. Of course, from March, the embassies were closed. So we have checked how many visas we have issued. In February and March, we've issued about 8,000 visas to China. We're revoking them. We're taking them back. The same as Iran, there are about 425 visas we have issued. We're also taking them back and saying the visas are now nullified. Yeah. Now the other countries, the remaining countries, are now forced to apply for visas to come into South Africa. The president said we are banning people from those countries from visit South Africa, and we found that the only legal mechanism to effect that ban is through issuing them with visas, so that we can control who comes in and who comes out.
Quite an interesting fact, and we need to address this one as well. I read about it briefly, but now I've got you in front of me, so we can talk about that. A lot of South Africans travel on 2 passports. So they'll leave the country on the South African, or they'll enter another country on that passport, then come back into South Africa on a South African passport, but there's no visa in their passport. You know how this works. What happens then? I've heard stories that South Africans with dual citizenship might actually not be allowed back into the country.
Well, look, you can't stop a South African or any national from coming back to their country. That will be illegal. It can't be allowed. Where do you expect them to go? Who must take care of them? We will allow South Africans to the country. But when we talk about these bans that the president has mentioned, it's not really more about nationalities. It's about destination, location. It's about where you come from. So that's why at our ports of entry, the remaining ports of entry, we are going deeper into the passport to see the stamps, literally. Which country have you been through to? Because we are aware that people will sidestep the rules and say, okay, they are banning people from the UK. I'm going to go through another different country and come into the South Africa. Actually, that has already happened. So South Africans who have got dual passport, for instance, if they want to leave the country and go somewhere, we'll allow them. But when we come back, we'll apply the rules and say the country you have been, you are not allowed in, or if you have to come in because it's your country, you have got, there are certain rules and protocols which Port Health will have to impose on you, like being isolated or like being checked or being quarantined and all that.
Okay, so those are the rules with regard to that. What about visas of expats from high-risk countries? If they expire while they're in South Africa, what do they do? Because this is a reality as well.
Yeah, it is a reality, and I think we've already announced it twice on what happened. We had a press conference on Tuesday evening at the airport for the ports of entry, the airports of entry. Yesterday we held it at the seaport for the maritime ports of entry. And in all of them we've announced the same thing, that for people who are already here, who are on visas, there are people who are on long-term visas, study visas, some are work visas, some are just visitors visas. But for all of those, if the visa is about to expire, we are prepared to renew them. They must apply for renewal of their visas. We are prepared to renew them at least up to the 31st of July this year, after which we'll check again. Take, for instance, if somebody is from Italy and say, I'm supposed to go back tomorrow or next week, and you know the situation there, there's a lockdown. We can't just say, please go. your passport has expired. We'll be able to renew them. After all, look at what China has done for us. They've kept our students in Wuhan for a very long time, some even for 3 months, and were able to plan thoroughly and bring them. They are now at the range. It was a very clean job in cooperation with China. So we also have to cooperate with other countries. Because the fight against this virus is about international solidarity. It's not about countries fighting each other. Say, no, you are banning my people, hey, you are throwing my people away. It's about containing a disease. Remember, this is not just done in the dark or at random. It's done in terms of the international health regulations of the World Health Organization. And the international health regulations is binding. There are 196 countries around the world who are signatories to that international health regulations of 2005. Is binding sets of legal regulations about containing diseases in certain parts of the world and not allowing the disease to move around.
Minister, we've run into news. I'm going to steal 1 minute if that's fine. Asylum seekers, refugees. This is an issue we know we're grappling with nationwide, but particularly within Cape Town. We know that this has been a big issue right now. What happens if they get coronavirus? What are we going to do?
No. The first thing we're doing, today, I'm signing a letter which I'm sending to United Nations High Commissioner for Refugees that they are leaving us with no option. We've been talking to them since the President's proclamation on Sunday, and they don't want to budge. I mean, there are more than 100 in that church already breaching the rules, which South Africans are not allowed to breach. There's a group at Lindela, the acting Director General of the Department of Home Affairs went to spend half a day with them on Monday, and they told him straight they are not moving. So today, Minister Naledi Pandor is calling ambassadors, and she said she's going to invite me, and I'm going to tell them, ambassadors from those countries, if they continue refusing to move from those areas, we'll have got no option but to repatriate them back to countries of origin. We are not doing that out of spite. But these are tough times, and we expect everybody to cooperate. The president has said no more than 100 people in any one area. There are more than 100 people holed up in a church in very serious and sanitary condition. There are more than 100 on the pavements next to the police station in Cape Town. There are more than 100 in Lindela. They have got to move. We've got no option. And we are not saying we are throwing them away. We said we want to reintegrate them from the communities in South Africa where they come from. Some have already gone there for the past 3 months and nothing happened. So anybody who says, I'm not moving, then will say, you are left with no option, we are going to have to deport you. And I'm going to tell the ambassadors that today.
All right. Minister, thank you for talking to us here on the program. Vital information coming your way from our Minister of Home Affairs. Another thing that he did tell me is that I mentioned to him that in Johannesburg there was a whole briefing put out about the closure times of clubs, restaurants, shebeens, but that I thought was for the city of Johannesburg. What you're telling me is these operation hours from 9 in the morning until 6 is nationwide.
It's nationwide.
So
it's
no
also in the regulations.
Bar, nothing is right to operate after those hours, not just in Johannesburg.
At least I know about shebeens and where they sell liquor. The other eateries, I'm not sure yet. Let me not commit myself. But where they are selling liquor, where people just gather for the sake of drinking, we saying they must it must be a takeaway by 6 o'clock. They must close, because we all know every single infectious disease will spread with alcohol where people are drinking. There's no question about that, and it's not something that we can prevaricate. They've got to close at 6 to take away and go and drink at home.
Minister, thanks for talking to us. This was our Home Affairs Minister, Dr. Motsoaledi, talking to us about a range of issues with regard to coronavirus. I know this is the top story in the news, so there's more to report on that. Sakina's got some details for us. Sakina?